craziness about fluoride. As a pediatric dentist on a daily basis, I have almost every single mom and dad asking me, Dr. Olga, what is your honest opinion on fluoride? And it's so hard for me to answer because there's so much information. So I spent a couple of days researching all this fluoride frenzy. We're adding fluoride, we are removing fluoride, we are prohibiting fluoride, we are looking for new solutions, which kind of exist and maybe not. So I will share with you my expert opinion on fluoride situation in the United States in 2025.
Welcome to the Ask the Dentist podcast with Dr. Olga Dolghier, where your smile meets your overall health.
Before I start telling you my own opinion, I want you guys to have your own opinion and share with us, what do you think? Are we all getting poisoned? Have we been poisoned since 1950s and all of us now have low IQ? Is that the case? Are we all dying from cavities? And do we have cavities on almost 90% of our population? And fluoride didn't work for the past 70 years? That's another question. So what is all this craziness about? Well, what is fluoride and when we started using it? So let's talk about history of fluoride. Where does this fluoride come from? That's history of adding fluoride to water. So actually it was added in 1945, first time at the city of Grand Rapids, Michigan. Why was it added on? Because in Colorado Springs, Colorado, they noticed there was a group of one dentist, his name was Dr. McKay. He noticed that people have malted teeth. They had yellowish or brownish stain on or all over the mouth. All the teeth were stained. But also in the contrast, they didn't look good. The teeth were not that nice, bright and white, but they didn't have cavities, or the frequency of decay was low. So then they started to kind of dig in deeper and deeper. And then another public health advocate, Dr. Dean, he actually did the correlation between decay and fluoride. So in 1930s, they started to see that fluoride actually changes mineralization of the teeth, and people who are exposed to a certain amount of fluoride tend to have less cavities. So the conclusion was made that if we add fluoride to water, maybe it would be huge benefits for overall population to fight the dental decay, which was prevalent during that time. So that's what they did. They started to add fluoride to water. And according to the study based of the 1940s, 1930s, they actually saw between 1945 and 1950, 70% decrease in childhood caries. Decay in children, 70% decrease. So it's a huge number, 70%. That means technically we don't need dentists if 70% of population has no decay. But then things started to change. So in 1960s, toothpaste, mouthwash started to be introduced. In 1970s, they started to see like what is the optimum level of fluoride, what is the optimum level. They were talking about 1 part per million was optimum level for fluoride in water. They started to look at the fluoride concentration in toothpaste. So they kind of, it sounds like there was a bulk of material, bulk of data, and they started to kind of sort it out in 70s and 60s. In 80s, some studies came out with like negative, content. They were talking about the cancer relationship with fluoride, the relationship between bone density, osteoporosis, So something else started to come out in the 80s. But back in the 90s, the fluoride kind of started to go globally. So now already Australia adding fluoride to water. Now we have Canada, UK, everybody adding fluoride to water. Europe did not add fluoride to water everywhere because I think it was just a logistics. For some reason, they did not do that. And World Health Organization started to support water fluoridation as a very effective measure for caries reduction. In 2000, they did long study in US, long study in Australia with a great data, and that's when I went to dental school, early 2000. I remember we were all taught that fluoride only beneficial for teeth, and we didn't even describe any negative effects back then. New research started to come out in 2015. So 2015, scientists actually started to look at numbers, and they decided that the best way would be to decrease fluoride, because now in mid 2015 they see a little bit of fluorosis. Fluorosis is when you see white spots on kids' teeth or adult teeth. And there's different form of fluorosis. It can be mild to severe. So mild one is just a couple of dots. Moderate is more changes the structure of enamel. It becomes like crystallized. It's like little fluoride crystals, which are in enamel, and changes the tooth structure, changes the color. So in 15, they kind of backed off a little bit, and they were starting to say that maybe we should decrease the amount of fluoride in water, and actually change the guidelines, and I believe it was 0.7 parts per million at that point.
You're listening to the Ask the Dentist podcast, because every healthy body starts with a healthy mouth.
Now we're back in 2019, and there was a huge controversial study when they first discovered that actual IQ, scientists found that IQ in kids who were exposed to fluoride when they were in utero and as toddler, the toddlers' IQ were lower than kids who were not exposed to fluoride. So it was like a first sign of something might not be right, what we all believe into. And then in 2025, they did the scientists did a huge meta-analysis. JAMA Pediatrics actually come up with a huge study, and they did have some evidence that fluoride might lower IQ. And then I kind of look into that particular study. That study has some bias. Number one, it was completely outside of US. There was that meta-analysis was done based on 74 different studies from different countries. So it was China, India, Iran, Mexico, non-US studies, and some observations were correlated to evidence. So it was very high risk of bias, because it was 52 studies done by separate countries, and so the evidence were not 100% conclusive. I wish there could be bigger evidence and more deep analysis of correlation between fluoride and IQ.
You're listening to the Ask the Dentist podcast, because every healthy body starts with a healthy mouth.
So now, the 2025, all the studies which we see, we don't dig into those studies and break down why are they good studies or not so good. My understanding that more studies needs to be done to have the clear correlation, because think about it. Okay, this mother is pregnant in India, for example. They measure the amount of fluoride in urine of the pregnant mother, and then they measure fluoride in kids, in toddlers in urine as well. So did these kids were exposed just to fluoride from water or toothpaste, or were they eating food which was grown on the soil with high fluoride concentration? What exactly was concentration of fluoride in water? From what I see in India, the concentration of fluoride in water is higher. It's about 1 ppm. So it's very hard to judge and say conclusively that fluoride and the IQ are 100% correlated. So I wish we can have more studies. Plus, what is IQ? IQ, genetics is involved, right? This mom can be, I mean, genetically, we are not all equal, right? Some of us have higher IQ level, born with technically. Some of us don't have such a IQ level. Or, for example, nutrition level. Nobody look into nutrition. Is this population in Mexico, were they well nourished? Did they have enough minerals, vitamins, and everything else which contributes to brain development? So it's so hard to do this study and come up with a conclusive evidence. But I think it's a good idea to do alarm about the correlation between fluoride and IQ. And I think it's a good idea that we all look into this and kind of trying to figure it out, is there truth and merits to it? So on opposite evidence, I found some studies from New Zealand and Sweden who found no IQ difference in adulthood with non-fluoridated and fluoridated community. And in Spain, a study of 2021, they actually said that the IQ improved in boys who were exposed to fluoride. So there is so much controversy. And I think we have to look at the big picture. That's my opinion. I gave you kind of breakdown where is this fluoride coming from, but let's talk about professional opinions here. So fluoride is well studied for over 70 years now, right? Our grandparents, our parents were exposed to fluorides throughout their lifetime. Do we all as a country have lower IQ than other countries? Um, I don't think so. So I think we have to look at the bigger picture. Maybe fluoridation as a massive mitigation of the population, maybe it's not ideal. But I think that it's enough evidence to support that it's beneficial for teeth in particular. Because now if we look what else is out there, what else is available, and a lot of parents asking, oh my God, xylitol, we are using xylitol. Well, I have a bad news for you, because another study came out and they said that if, the scientists found that if it's a high amount of xylitol, it actually changes your biome of your gut. So high concentration of xylitol, you actually getting dysbiosis of diarrhea actually with the xylitol. And there are some studies correlate the sugar alcohols with increasing blood clotting. So it's just so much controversy with that. Xylitol, again, I think everything is good in moderation. So xylitol, I think, is beneficial if we periodically maybe chew chewing gum after we eat. I don't think it's harmful. I think it's beneficial because you create a lot of saliva flow. So from that standpoint of view, I would say xylitol is beneficial. Would I brush my teeth only with xylitol? Probably not, because I don't think it's effective enough to actually improve remineralization. Because if the cavity, from cavity standpoint, when as a dentist, when I see white spot on the tooth or on X-ray, it looks like a small shadow in between teeth, that means the process of demineralization starts. Demineralization is when we lose calcium from the tooth, and to add calcium back on, as far as we know, the best evidence is fluoride actually needs to bond to calcium, and then it brings the calcium ion to the tooth back. So that's why fluoride is effective. Xylitol is more like antibacterial effect, not necessarily the remineralization. If we look at alternatives like hydroxyapatite is another one which it's big fans about, okay, let's use hydroxyapatite. That's what our teeth are made out of. But hydroxyapatite, there is very limited data. So all the data found, it does have positive evidence, but is it a good research study? Does it have, it's like a broad meta-analysis where we analyze thousands of kids like we did with fluoride? It's actually very limited data. And then some studies shows that nanoparticles, they are so small because nano-hydroxyapatite, it might penetrate, for example, your gut barrier. So you might have, like, now it's the new thing, leaky gut correlation. And so it's so hard to say that nanoparticle does it cross your blood-brain barrier? I hope not. There's no evidence of it that I can see, but it's nanoparticle. Nanoparticles are microscopical, so they can't go into places where you don't want them to go. And there's limited research data on the hydroxyapatite. So you have to think, like, fluoride, yes, we know IQ, right? Which is not a good thing. But then hydroxyapatite, we don't know where is it going to end up. And we also don't have good data telling us that it's effective. So I still recommend, like, maybe using, if I see cases when it's a rampant decay, and I think diet is extremely important, oral hygiene. But if you're going towards the toothpaste, I still, for those rampant decay cases, I would recommend probably fluoridated toothpaste in this case, because I just hydroxyapatite as alternative, but I don't have a good data, good backup to just say 100% that's very effective. It does have good numbers, but the amount of information we have of it is very limited. And let me tell you this. If you look at the big picture of United States, after the study came out, meta-analysis, which is a very big study, the states, Utah and Florida, completely prohibited fluoride from adding to the water. So they banned fluoride completely. But if you look, and I started to look at the other states, New Jersey and Connecticut, actually, they want to add fluoride. So because their population has very high risk of decay, and they are states with the lowest number of population. New Jersey is 14 to 23% of population actually exposed to fluorides through water, and Connecticut is pretty low as well. So these two states want to add fluoride to the water. So me as a provider, as a practitioner, I have to sort out all this biased data. I want to bring the best information to you, and trying to figure out where is the truth. I did my residency in Philadelphia, and I did practice on the border with New Jersey. And I have a couple of dentists who practice in New Jersey. And it's not a good study, but what we saw was a very high amount of risk of decay. Every single kid will have decay everywhere. So New Jersey in particular have very, very high decay rate. Is it because of the fluoride, or is it because of diet? I don't know. So you have to kind of look at the big picture again. So now we have the opposites, right? The Utah is dropping fluoride, Florida is dropping fluoride, and New Jersey and Connecticut adding fluoride. So as a dentist, my hair goes up, it's not easy to figure it out, all of it, and what to do. But I want you to understand that we're trying to find the best solution, and it's very difficult because cavities are forming. It's not just fluoride and no fluoride. So if you have fluoride, you're not going to have cavity. You don't have it, you're going to have cavities. That's not the case. Believe it or not, usually the bacteria which grows in your mouth, we call it biofilm. It's what bacteria produces, but biome of your mouth and your gut is related. So I think the relationship between gut bacteria and oral bacteria has really tight connection. I believe that I cannot tell you that sugar causes cavities necessarily, but bacteria, which is strep mutant, in order to get to the tooth, we have to have glue. And the glue is actually the simple carbs, so technically sugar. So in order for bacteria to stick to the tooth, we need to have sugar. That's why that's not, if you have no bacteria in the mouth and eat sugar, you're not going to have, nothing going to stick to the tooth. But then you have to look at acid as well. Where this acid coming from? So acidity and sugars are two big enemies of your mouth. I would say acidity is bigger enemy. Where's this acidity coming from? So you have your internal sources, for example, your gastric acid, which you can have GERD, gastroesophageal reflux. And we as a dentist, actually, if you look in the mouth, we can tell you, okay, are you grinding your teeth or do you have acid attack in your mouth? And this group of population, me as a practitioner, I see that they are more prone to decay. So the acidity is definitely a big factor. The question is, how do we change the acidity? Well, we can get gastroesophageal reflux under control with medications. Also, we can change pH of the mouth, but it's very difficult to change because it depends on what kind of biome we have. So we have about 700 different type of bacteria in the mouth. And all of us have different levels, different concentration of certain bacteria. Yes, we can test you for what bacteria do you have, but if we kill one bacteria, then the another one gonna grow more. So by doing antibacterial agent, it might not be the good solution, because some studies shows that good bacteria dies out faster and bad bacteria grows back faster. So antibacterial might not be effective. Probiotics. So some moms come in with toothpaste, like literally with like a toothpaste, and they are telling me, okay, look, Dr. Olga, I found this one, this has probiotic. Okay, some studies shows that probiotics are very beneficial, but for a short period of time. Even for your gut bacteria, if you're consuming probiotics, they do change the biome of your gut, your GI tract, your mouth. But to maintain the gut bacteria, for them to survive, you have to have certain conditions. So, and we still don't know how to alternate the environment. So from mouth standpoint of view, we know if kids get tartar buildup, calculus, and they overall have good oral hygiene, so their pH of the mouth is probably more basic than acidic. So these kids don't have as much decay, technically. Sometimes we see both calculus, but it's from not brushing, and also cavities. But a lot of times there's a joke, oh, you either have perio or you have decay. Sometimes you have, well, perio is a gum disease. So how to maintain good biome? I think acid plays a huge role. So the biome should be maintained by good prebiotics. Prebiotics is what you eat for your guts, for example, to maintain, for example, fiber. That actually becomes more positive environment for good bacteria to proliferate and grow. So it's complicated. So this short answer, can I use probiotic toothpaste or take probiotics and fight decay? You can alternate the biome of the mouth, but we don't know for how long and how effective it would be long-term wise. So we can introduce probiotic, and there's companies which coming out with 2, 3, 4 different strains of probiotics, which are beneficial. But remember, we have 700 type of different bacteria in the mouth. So those 3 and 4 might alternate it temporarily, but the long-term effect we still don't know. I think diet plays huge role. Even if we go back to fluoride, I think the IQ study could have some merits to it, because you cannot just look at water, also what you eat. In US, we eat a lot of processed food. So the ketchup, for example, is made, some of the ketchups made in the factories using fluoridated water. So when you evaporize the tomato and make that ketchup paste, you're actually making fluoride more concentrated in ketchup. So if your kid is organic, don't use fluoride toothpaste, they don't use fluoride in the office, buying all the organic water, but eat ketchup with your fries, you got that concentrated fluoride going into your system. So now think about it, we're eating all processed food which is used with fluoridated water, right? And now we're actually introducing higher concentration of fluoride from different food sources. So that's why I think maybe overall concentration of water fluoride could be lowered, because we have different sources and it's so difficult to trace down those sources. So going back to diet, your diet should be more well balanced. So more natural foods, fruits, vegetables, eating meats, eat different nuts and seeds. So certain type of seeds actually fight bad bacteria which cause cavities. So it's a more complex approach. So we can create protocol for you, for example, to introduce certain type of good snacks type, changing the way you consume your snacks, because if your kid even eating good snack every 15 minutes, your mouth, every time we eat, remember those bacteria, we have fermentation process, we're creating lactic acid in the mouth, and then your mouth becomes acidic. So if your kiddo is sitting and eating anything, technically, the pH of the mouth is keeping dropping and it never raised up to normal levels. So maybe having longer time between snacks. For example, some studies shows that your pH of the mouth actually bounce back to normal within 2 hours from the time you consume food. So redoing the whole snacking pattern, redoing what we eat, analyzing what we drink, taking consideration your sources of fluoride, of non-fluoridated toothpaste, and that would create kind of a bigger picture of your mouth health. And remember, mouth is part of your gut, because that's how you start your GI tract, by eating in the mouth. And maybe it will improve overall health, because I don't want you to think about dentistry as like we are tooth doctor technically, but you have to look at overall body, because you cannot separate your mouth from the entire body. And that's what I think we have to be trained more as a dentist, is on systemic involvement, because in the US, every single specialty, every single profession is very compartmentalized. Like, okay, you have problem with GI, you go to GI doctor. You have problems with your tonsil, you go to your tonsil doctor. But I think if you would look at the big picture, why do you even have problems with your tonsils? So now I'm going into different part. Why do we have, for example, mouth breathers, right? Now we're looking at the facial structure of this kid. And do we have cavities? Do we have from not efficient fluoride consumption? Do we have cavities from bad diet? Or do we have cavities because of his facial features, because he is congested all the time? Why is he congested all the time? Is he allergic to certain things? Is he tongue-tied, has a poor posture of the tongue, and it shapes his mouth, which is another controversial topic. Not everybody needs tongue-tie release. Not everybody has different type of facial features only because of the tongue-tie. So it kind of opens us up to a different conversation about breathing, about airway, about systemic involvement of your face, mouth structure to your overall health. Is this kid I see at 2 weeks for lip tie and tongue tie release, is he going to develop sleep apnea when he is 80? I cannot guarantee that. It has some controversy to everything. So this is my first topic today, talking about diving deep into fluoride, because that's number one question we see from the parents, but there's so much to discover. If you love my podcasts, please like us and share with people who are interested. I'm not sponsored by any companies. I'm giving you 100% honest information, which I'm doing research myself, because my goal is to dig through the whole turmoil of misinformation, good information, sponsored information, and bring the best to your child that they can stay healthy for life.
Thanks for tuning in to the Ask the Dentist podcast with Dr. Olga Dolghier. Remember, a brighter smile leads to a healthier you. Join us next time for more tips, stories, and inspiration for your journey to total wellness.